Welcome, everyone. So glad you have joined us today. I'm going to invite Kathy McCall to kick us off from AARP.
Thank you so much. I'd really like to thank Aging and Disability Services, the Washington Association of Area Agencies on Aging, and the partners that are here today. My name is Kathy McCall. I am the Advocacy Director for AARP here in Washington State. I'd also like to thank our very special guest, Congresswoman Suzan DelBene. And she has been such an incredible champion for such a variety of issues related to older adults here in Washington State and nationally. She's advocated for a variety of different policies, and AARP has been very fortunate to have worked with her on several occasions with bills related to lowering the cost of prescription drugs, and wanted to thank her especially for the work that she did on the Inflation Reduction Act and that momentous historic bill that has just been signed by the president to really drive down the cost of prescription drugs for older Americans and older adults who are on Medicare. It is just really substantial in terms of Medicare's ability to negotiate for prescription drug pricing and to set caps on the amount of money people spend out of pocket each year for prescription drugs. So again, thank you, Congresswoman DelBene. It's also my pleasure to introduce Tanya Kim. Tanya is the acting director of the Seattle Human Services Department, which serves as a funder, convener, and direct service provider for Seattle's safety net. Director Kim leads a team of nearly 400 staff who invest more than $500 million and other resources in community-based organizations, including those that support older adults. Again, thank you to everyone for joining us today, and I hand over the virtual mic to Tanya Kim.
Good morning. It's so great to be joining this event today, and this kind of partnership and dialogue between organizations, elected representatives, and community members is exactly what we need to make progress on something we all care about: health and well-being of older adults. Health is a top priority for Mayor Harrell. Equitable access to care is an important component of our Seattle's vision of One Seattle, and we want to see Seattle have one of the healthiest populations in the nation. We are currently consulting with experts and partners to build a Health One model that advances coverage and care for all. And that includes older adults in our community. The city of Seattle is proud to be an age-friendly city since 2017, and we have a long-standing commitment to addressing the needs of older folks in the city. We serve as our region's Area Agency on Aging, or AAA, and we regularly get input from older adults who serve on the Advisory Council and the Mayor's Council on African American Elders, among others. We know the population of older adults is increasingly diverse and represents a range of unique needs. Living a healthy life is important to everyone. Seattle is committed to creating a city where all people can age in good health, regardless of race, income level, gender, or zip code. Thank you again for being a part of this important conversation. I'm now going to hand it over to Kathy Knight, who, after leading the City of Seattle's Aging and Disability Services Division, has gone on to become the State Director for the Washington Association of Area Agencies on Aging. Kathy, please take it away.
Thank you so much, Tanya, and it's great to see you again. I'm honored to be here today to represent the 13 area agencies on aging in Washington State and to be partnering with AARP and our King County Area Agency on Aging for this conversation. I want to echo the comments already made by Kathy McCall and Tanya Kim, and to thank Congresswoman DelBene for all her work to support older Washingtonians. As a champion for the Older Americans Act, Congresswoman DelBene knows this landmark legislation was the bedrock for the important work of the over 600 area agencies on aging nationwide. For almost 50 years, local area agencies on aging have been the trusted resource that helps older adults and people with disabilities live with optimal health, well-being, independence, and dignity in their homes and communities. And now it's my pleasure to introduce Mary Mitchell, Director of Seattle's Aging and Disability Services Division. Housed within Seattle's Human Services Department, Mary's team also functions as the local area agency on aging. She leads the largest area agency in our state, serving more than 50,000 adults, their families, and their caregivers. I turn it over to you, Mary.
Thank you, and good morning, everyone, and thank you so much for joining our conversation today. As the director of the King County Area Agency on Aging, I am thrilled to be a part of such an engaging community of folks willing to show up and take part in these discussions. This is actually the first time we have done an event like this, and virtually nonetheless. So thank you in advance for your grace as we learn and grow together and deal with any technology challenges. We can make a huge impact in the lives of older people, but this requires partnerships at all levels of government, which is why I am so grateful that we have champions like Representative DelBene in Congress. I'm going to introduce the Congresswoman in just a moment, but first I'd like to outline the structure of today's events. This is a Q&A conversation with Congresswoman DelBene. I will ask a couple of questions, but I will mostly be turning the floor over to older adults who live in the Congresswoman's district and have personal experience to share and questions to ask. We have a few folks already lined up, and I'll be introducing each one before they ask their question to the Congresswoman. While we won't have time today to get to audience questions, we will provide email addresses so folks can follow up later. I'd like to welcome Representative DelBene to the virtual stage. Hello, Congresswoman. It's great to have you with us today.
Thanks, it's great to be here.
Thank you. If you don't already know, Congresswoman Suzan DelBene represents Washington's first congressional district and has been serving in DC for a decade. She holds a powerful position on the Senate Ways and Means Committee, and her work focuses on a range of issues including technology, trade, taxes, environmental conservation, and particularly relevant today, healthcare. Congresswoman, I would like to express my deep gratitude for you and the other members of Congress who recently passed the historic Inflation Reduction Act at such a pivotal time. Can you please kick us off by telling us a little bit about this legislation and what it means for older adults?
Thanks, Mary. Absolutely. The Inflation Reduction Act really is a game changer for older Americans. We know that many are on tighter budgets and are worried about inflation, and this law will lower costs in ways that seniors feel. So starting in January, the law will cap monthly insulin costs at $35 for folks on Medicare. In 2020, the average out-of-pocket spending by Medicare Part D enrollees per insulin prescription was $54. So that already shows you the impact of a $35 cap. Second, it will cap out-of-pocket spending at $2,000 annually. So we know this will not only lower costs, but it's really going to provide predictability and certainty to older Americans, which is so critical as folks are budgeting. In 2019, 1.5 million seniors spent more than $2,000 on prescriptions. And for those who need drugs to treat cancer, multiple sclerosis, rheumatoid arthritis, for example, there's so many things, this will make a significant difference. It also will offer older Americans free vaccines, including for COVID and for shingles. And finally, the law will allow Medicare to negotiate for cheaper prescription drugs, something we've been working on for so long. The private sector already has the ability to do this, And I've long believed that Medicare should have that ability as well. So this law, and it really makes is something historic, will allow Medicare to negotiate. That means that it will really make sure that our tax dollars are getting the best deal possible on some of the most widely used and expensive drugs. So just really big things in this piece of legislation, and so something that I think is historic and will make a huge difference in costs for older Americans.
Thank you. And yes, the cap on the reducing the insulin costs will have a huge impact on our community. So thank you. So now, as you heard in the opening remarks from my colleagues, Seattle is a part of AARP's network of age-friendly states and communities. This means that we, along with many other cities across the country, have committed to advancing the health of older adults. I think you share this mission. Can you tell us about your bill called the Improving Seniors Timely Access to Care Act?
Absolutely. So, and you got that out, which is a mouthful, but the bill really is exactly as it says, improving seniors' timely access to care. It will make it easier for older Americans to get the care they need and improve health outcomes. Right now, really at the core, the bill would modernize a very antiquated prior authorization process in Medicare Advantage. So many times you have a procedure that needs to take place, a surgery, something your doctor wants to do, and you're told that they have to get authorization from the insurance company before they can do that procedure. That's prior authorization. Many times doctors and nurses and others have to fax documents to insurance companies. They can ask different questions. You can fax information. They can ask for more information, even for very common standard procedures. So what the bill does is it modernizes it. We require folks to use electronic technology, just like we are now, to send information in, to have standardized forms so doctors and healthcare providers know what information is required, and to provide that information back to the Department of Health and Human Services, so that we continue to make sure that folks aren't unduly holding up access to care. This bill has incredibly strong support, very bipartisan, over 300 co-sponsors in the House. We passed this bill through our committee, the House Ways and Means Committee that I serve as vice chair of, in July, and we expect to have a full vote on the House floor this coming September next month. So it's supported by 500 healthcare organizations. I think as we move it, we hope to get that through the Senate, and it will mean fewer headaches for you and your families. It'll make easier for your medical providers to make sure that they can make sure they give you the healthcare you need in a timely way. So I'm very excited about seeing this bill move.
Thank you so much. And I'm sure several people on the call can appreciate this change that you are pushing for. And it will allow us more time to be able to focus on our care and recovery instead of getting caught up in paperwork transmission. So thank you so much for being a champion and pushing that forward. Now I'd like to turn things over to one of Congressmember's constituents, Sheila Mary. Sheila is on the Seattle Mayor's Council of African American Elders and is a naturopath doctor. Sheila, the floor is yours.
Thank you. And again, I'm a naturopathic doctor with a master in public health, and I have a background of international medical doctor and dentist. I am originally from Haiti, but for the past 6 years, Washington State, more specifically King County, has been the place that my family and I call home. While living in Washington State, I had an encounter with an older gentleman that is still haunting me till this day. He was in his mid-60s and came seeking care for many issues. When he removed his jacket, a clump of body lice fell on the floor, so much that we had to shut down the place and call pest control to treat the facility. This man had several mental and dental issues, and it was obvious that he had not been seen by a medical provider in a while, and he was not in a mental and physical state where he could take care of himself. I tried to find a case manager to help him coordinate his care, but I couldn't because everyone was at capacity and couldn't help him. I often think about this older adult and how we couldn't meet his needs despite our best efforts. And I think about the barriers such as healthcare affordability, capacity, and access that prevented him from finding the assistance that he needed. Medicare and Medicaid are both vital lifelines for older adults with growing healthcare needs as they age. And there is an urgent need to strengthen these programs for future generations. While I am extremely thankful for the Inflation Reduction Act and how transformative it will be for healthcare affordability, I would like to ask, what are your plans to further improve access for older adults and persons with disabilities, such as improving telemedicine options and expanding Medicare coverage for vision, hearing, and dental? And also, what challenges are you experiencing in DC and how can we help? Thank you.
Thank you. Thank you so much for joining us and for sharing your story and your work as a healthcare professional. You asked a lot, and I think all of this is important. We need to make sure that everyone in our country has affordable, quality healthcare, and early on, so that people are able to get healthcare before conditions deteriorate. That leads to better outcomes if we can get there early. So this is an ongoing effort. You asked specifically about improving options like telemedicine. I actually think we have seen a huge growth in telemedicine, growth that we never would have seen otherwise because of the pandemic. I've been a supporter of expanding telehealth services. And now that we've seen this kind of rapid increase of care, we've also seen the results. It's been incredibly helpful, especially for older Americans who might have been more isolated during the pandemic, or for a lot of folks in rural communities trying to, with the challenges of travel to get to a healthcare facility that might be far away. So telemedicine's allowed seniors to get care at home without exposing themselves to COVID. So we have had, and a lot of this went in place because we put waivers in place in the law to allow many more folks to provide telehealth services. So now we need to make sure that we keep those, that we create the long-term policy allowing telehealth now that we have the evidence and support for that. So we need to make sure that our laws and policies are up to date with the changes in the industry. Some of that we're working on right now. Taking those waivers and making long-term permanent policy is important, so that we continue to ensure quality care. And that means, when I say telehealth, it also means audio only. We have folks who don't have access to internet to be able to do a video conference like we're doing right now. And so audio only is really important, even in parts of the region I represent, where we don't always have broadband access in all areas. In particular, in vision, hearing, and dental, which you brought up, these are very important and they're key to healthcare. In the House, we worked on that in legislation to try to provide more benefits, part of what we were looking at in the Build Back Better Act earlier in the year. Unfortunately, those pieces did not make it into a final bill. So we're going to continue to look at other ways we can get this done. We know the impact that dental care has on people's overall health, vision has on overall health, hearing has on overall health. Clearly, it makes sense that we don't think comprehensively about healthcare in that way. So there's more work to be done there. And on hearing, as many of you may know, the Biden administration recently made changes that will allow older Americans to purchase hearing aids over the counter without a prescription. So that might provide more accessibility and affordability to some. And then to your point, just kind of how can you help? How can you help is just, I think the story, continuing to provide stories and engage with elected officials at all levels, and as a healthcare professional, work with other healthcare professionals so that we continue to push on making the reforms we need to our healthcare systems that support patients and support better outcomes. So thank you for your work and for your engagement, and all of that helps all of us lead to get better results in the end. The Inflation Reduction Act is a piece, but there's definitely more we need to do.
Thank you, Congresswoman, and thank you for highlighting the need to focus on healthcare in a holistic manner. I think that's very important. So now I'm going to pass it on to another one of your constituents, Ron Vivian. Ron is a community advocate who is involved with the Dementia Action Collaborative and served on the State Council on Aging, as well as the Advisory Council for Snohomish Area Agency on Aging. Woo. Ron, please take it away.
Thank you. Representative DelBene, it's good to see you again. Hopefully we'll get to see you in person in the district on a campaign stop this fall. Sandy and I are very proud of the work you do and are so glad you represent us. Today, I want to express my concern about the health of our country's caregiving network. In 2017, caregivers provided $470 billion of unpaid care in the United States. Most often, family members provided this critical care without pay and often conflicting with their ability to earn wages and benefits and to face today's financial challenges. We need to find solutions so that those who carry the burden of caregiving responsibilities can continue to do this important work. Caregiving issues are close to us personally. My sister-in-law in rural Nevada lived in a long-term care facility for 2.5 years. With no family nearby, her friends stepped in to provide help twice a week, every week. Winter and summer, they ran errands, provided personal care for her, and were there when she needed them. She was fortunate to have them, and they made a big difference in her last years. Caregivers matter. At the moment, we have close personal friends on one of the San Juan Islands who are facing multiple medical challenges. But like many in our largely rural state, they cannot find a qualified caregiver even though they are prepared to pay. The result, they are preparing to leave their ancestral home. While Washington State is a leader in home and community-based care, we are seeing challenges in recruiting and retaining care workers, and specifically being able to offer competitive wages. The need for professional caregivers continues to grow. How is Congress responding to the need to stabilize and strengthen the direct care workforce that supports vulnerable older adults? And thank you for your service.
Thank you, Ron. This is a really important question, and you pointed out so many challenges that we face, frankly, challenges that we faced before COVID. We had a caregiving crisis before COVID, and COVID made it much more difficult and really shined a light on the challenges that we face. As you said, caregivers have been underpaid, unrecognized, and undervalued for far too long. In fact, just this week, the Department of Health and Human Services awarded $25 million in planning grants to expand access to home and community-based services through Medicaid's Money Follows the Person program in 5 new states and territories. So that's will be important to addressing this. The American Rescue Plan temporarily increased Medicaid funding by an estimated $25 billion for home and community-based services. So those were important, these are important investments, but there's much, much more we need to do. We need to make sure that families are able to have time off to take care of family members. So when we've talked about paid family leave, thinking broadly about a leave policy, so that because families are taking care of families, one important policy that the caregivers, the caregiving workforce that you pointed out is we just don't have enough. We don't have enough healthcare workers broadly. We definitely don't have enough caregivers, and I've talked to caregivers who are struggling to meet the needs in their communities, trying to do everything they can to meet the needs of multiple people. And you point out rural communities, absolutely. Rural communities struggle because harder to get to, might be a longer drive, less people available to work in those areas. So we need to look comprehensively because we know that if we can keep people, as you said, in their communities and their homes, it's better for everyone involved. So part of it is making sure people make a living wage and can afford to be caregivers. That's an important part of our job collectively. Part of it is the time for family members, I said, and the investment that we make. I'm a original co-sponsor of a piece of legislation called the Better Care, Better Jobs Act, which would strengthen and expand access to home and community-based services by providing states enhanced Medicaid funding and incentives. So there's more we can do at the federal side also to make sure we have resources that can be used by states or even local communities to help come up with ways that help meet the needs in those communities. But we are in a place right now where we don't have enough caregivers, and we need to make that a priority and value the incredibly important work they do that impact every single one of us and our families. So thank you for raising that.
Thank you, Congresswoman. And now I'm going to hand it off to another constituent, Diana Thompson. Diana is a member of the King County AAA Advisory Council and is also involved in several other advocacy organizations. Diana, the floor is yours.
Thank you very much for your concern about senior health. And what I'm going to focus on is hearing loss and its impact on seniors. I started losing my hearing in about 1990 and have relied on hearing aids for approximately 16 years. Many persons with hearing loss don't own or use hearing aids, partly because of the high price, and others because they're embarrassed to wear them. Unfortunately, untreated hearing loss can lead to isolation and has been associated with conditions such as depression, anxiety, low self-esteem, cognitive decline, and falls. The August 8th, 2020 Lancet report concludes that hearing loss is the top risk factor for dementia. Last week, as you mentioned, the FDA released regulations for over-the-counter hearing aids, which will enable adults with mild to moderate hearing loss purchase low-cost hearing aids without seeing a medical profession first. However, seniors with severe or profound hearing loss will not receive any benefit from this the statute and the regulations. A 2016 article estimated that roughly 6 million Americans aged 12 years or older have severe to profound hearing loss in at least one ear, with 3/4 of these individuals being at least 60 years old. So can you share with us how can Congress support seniors with severe or profound hearing loss?
Thank you, Diana, and thanks for raising this issue too, because it is incredibly important. And as you know, traditional Medicare doesn't cover hearing aids or exams for fitting hearing aids. It comes as a big expense for seniors on tight budgets. There are some Part C Medicare Advantage plans that offer hearing aids, but it's not consistent. And as you pointed out, hearing aids can significantly improve quality of life for older Americans, but it's also a healthcare issue. It's not just quality of life. You said it reduces falls, improves mental health, the the ability to connect. We were even, talking about kind of isolation and being able to have a hearing aid to connect with others, also incredibly important. So there's more that needs to be done, because as we look at things, and clearly it's not just hearing, we've also talked about vision and dental services of other areas that are important to overall comprehensive health. I think these are things that we have to continue to address so that we can make sure that older Americans are able to stay engaged with their families and communities, but also look comprehensively, as Mary was pointing out, comprehensively at healthcare. So you talked about the over-the-counter part, that's important and can be helpful, but we need to do more, particularly to help folks with profound or severe hearing loss. So thank you, Diana, for raising that issue.
Thank you again for all of your advocacy work, and Diana, and sharing your personal story, and Congresswoman, your support of making sure that the voices of our community and their concerns are lifted up and addressed. And now I'd like to hand it over to Alex O'Reilly. Alex is an advisory council member for the King County AAA, and before she retired, she was a human service manager at the City of Bellevue. Alex, take us away.
Thank you so much. And good morning, Representative DelBene. While I'm not a constituent of yours, as Mary mentioned, I worked for over 25 years as a human services planner and manager with the City of Bellevue, and communicated with many residents who are older adults on healthcare and other human services needs. I have a master's degree in social work and policy and administration, and retired from the City of Bellevue in November of last year. As an influential member of the House Ways and Means Committee, you hold a deep understanding of how Congress allocates and pays for programs that serve older adults, like Social Security, Medicare, and the Older Americans Act. And we understand that Congress has a responsibility to its constituents to ensure the long-term fiscal health of our country, as well as develop budgets that reflect our values and goals for the future. And area agencies on aging really appreciated the temporary bumps to Older Americans Act funds during the pandemic, but are concerned that funding has not historically kept up with the rising costs of services, the growing aging population, or the ability to respond to emerging needs. And one emerging need related to healthcare that I became keenly aware of in my work in Bellevue was transportation. And you've kind of alluded to it recently about the rise in telehealth, which was wonderful. But a number of older adults who are Bellevue residents reported that they wanted to have in-person visits, and they could not get to healthcare appointments as they no longer drove, or they weren't on a bus route, and they made sometimes slightly more money than the income requirements needed to be eligible for volunteer transportation services. And one particularly heartbreaking story that I heard from some Bellevue residents was of an older man whose wife had to go into a nursing home, and since he did not drive and couldn't get a bus to get there, rarely got to visit her, which caused her mental health to deteriorate. In addition, as a result of the pandemics, as you mentioned also earlier, the pandemic's need for people to isolate, not being able to get to places to connect with family and friends for social support and other services has critically affected the mental health of all people, but especially true for older adults. And with the cost of living rising, many older adults whose incomes look good on paper just can't make ends meet to pay for things like Lyft, Uber, or cab costs. So as you know, an age wave is coming. By 2030, 1 of every 5 people in the US, or 20% of the nation's population, will be 65 or older. And we need bold action and innovation and proposals that center the working class, invest intentionally in education, public health, human services, and build an economy that works for everyone. So with that, I will ask 2 questions. What are some barriers or successes you have experienced in achieving bipartisan support in this work? And also, how can folks on this call help?
Thank you, Alex. Thanks for all of your work, and thanks for your question. when you talk about bipartisanship, so I have one good example, which is the, sorry, I think my video went out accidentally there, but it looks like I'm back. When you look at the legislation I was talking about earlier with respect to prior authorization, that was strongly bipartisan. I had Republican leaders helping me along the way. It passed through the committee with bipartisan support, unanimous bipartisan support. So I think there are examples of bills like this that can be a model of how we can work together. We saw a problem, we discussed the solution, and then worked with others to build support for that and get legislation we can all agree on. But the critical place, and this is usually where the disagreements involve when we're talking about how dollars are spent. And I have a very strong feeling that if you invest early, helping people out, you get a great return on that investment. When you wait till folks, in particular in healthcare, are sicker further down because they didn't get services early on, that's much, much more expensive for everyone, but also much worse in terms of the quality of life and the impact on any individual. So I talk a lot, not about spending, but investment, because I think the investments that we make in healthcare to provide care early on, to make it easier for folks to receive care, mean that these are investments that we make. And frankly, this isn't unique to older Americans. I actually think this is an important point for everyone across the country. We make those investments, we see better health outcomes. And frankly, it's easier for the healthcare workforce too, when they know they're able to help people early on. So unfortunately, some folks on the other side of the aisle aren't believers in Medicare, might look at privatization of Medicare. And my argument is that actually we invest in something that's been incredibly powerful and continue to make it strong and show great outcomes. That's the best thing we can do. So that's where some of those different agreements lie. And I think that the biggest thing you can do is continue to advocate, talk about how powerful Medicare has been and the impact that it's had, and what we can do if we continue to build on and strengthen Medicare. There's always something that we can do better. Things change, telehealth, right? That wasn't something we always were talking about. Well, now we see the impacts we can do it. And just also to your comment on transportation, we also have to think about all the services that go around with it, and maybe also to the point that Ron made on caregivers, that if we also have a strong caregiving workforce, those are other folks who are able to help get folks to appointments, keep people connected. That's also why our caregiving workforce, and frankly, thinking through about the impact of a caregiving economy has on our community. So I'm a big believer in continuing to make those investments, again, because we get such a great return for everyone. But folks need to hear that from their constituents directly and see the direct impact, your stories. That's what you can do to really help push that forward.
Thank you, Congresswoman. And yes, again, I just can't thank you enough for your leadership in improving the qualities of lives and making sure our constituents have access to resources, and everyone's participation and willing to step up and bring their voices forward. It's very important. So we do have additional time for some questions, and additional times if there's some things that you would like to highlight. How about we take a question regarding the Inflation Reduction Act?
That'd be great.
Okay. So while this act does many great things, it is a little bit disappointing that it did not ultimately include a major investment in public health. Can you tell us about any future efforts to fund public health, and what can we do to help?
Great question. And I am a big believer in public health, and I hope now that folks have seen, the impact that public health has had during the challenges we face in the pandemic. They will realize how important it is we continue to invest and have a strong public health system across the country. A lot of folks didn't really know what public health did, or even knew that we had such a important public health system in our counties across the state. But we saw the incredible impact they had when we were hit by COVID. Our community right here in Washington State was the first hit in the country, and we got hit hard by COVID outbreak. And from the beginning, it was public health officials who were helping to try to figure out the response, not only to help those who had been impacted by COVID, but also to make sure we did what we could to protect others from getting COVID. So this is we know that strong investments in public health help us going forward. And these are local officials who are on the ground, and they need resources to continue to do their important work. My concern, and to your point, is that if we don't learn from the lessons of this pandemic, the lessons that we need a stronger public health infrastructure at the ready, that we will, something new could come up that could impact our communities again. And so a strong public health system keeps us all of our communities healthier and safer going forward. And our public health workers really have been heroes. They are very tired after 2 years of a constant pandemic response. And now we have a recent monkeypox outbreak. Another reason, and that's why I think it's important to not think of this as just a workforce that's there to address COVID, right? They are there to address our public health system overall. And there will be other things, monkeypox being an example, so we need to remember that future public health crises can come, and we need to be prepared. So the quicker and the better that we respond to any type of public health threat, the more lives we can save, the more resources we preserve, because we're better prepared. So I think front-end investments in public health are how we do that. And we're going to keep trying to make sure that we have strong investments going forward.
Yes, thank you. And, the testament of the nation pulling together, doing COVID, public health leading that effort, and everyone rallying together, right? It does make the case to show that we need to make sure that we keep our investments in public health strong, because that has guided us through a pandemic, right? And you mentioned monkeypox, and the next thing that's on the horizon, right, that we don't know is coming. We have to make sure that we are investing early and staying prepared. So Alex touched on our population that's aging, right? And in King County, estimates indicate that by 2050, the number of adults aged 85 years and older will increase almost by 300%. And today's population of older adults is increasingly diverse. We know that racial and social injustices compound over a lifetime. And it's no surprising that Black and Latinx women experience more poverty than others in their later years. Seattle's Mayor's Council on African American Elders has long advocated for an equitable approach to healthcare. Can you talk to us about federal investments being made to address the social determinants of health?
Thanks. Also a very good question. This is an issue that we've been addressing across the board with the Biden administration. The American Rescue Plan made key investments in social determinants of health. It makes health insurance cheaper, something that we extend in the Inflation Reduction Act, cheaper and more accessible to millions so that they can get the care that they need. The administration is also honed in on the mental health crisis, and we talk about holistic health. We also need to make sure we always remember mental health is part of holistic health. We see big divides between income groups on their ability to access care. So the White House has proposed a plan to bring more providers into the field, train a diverse group of paraprofessionals, better integrate mental health care into frontline care providers. And it recently launched the 988 program, the hotline that folks can call if they're having a mental health crisis. All of these things are important, but to helping address our communities and provide care for our communities. But to your social determinants of health question too, I want to highlight the other place we've been looking at is in research. It's important when we're doing medical research on issues that we're looking at the diversity of our communities too, and understanding that we can have different types of diseases, can have different impacts on different populations. So we also have to be very thoughtful about how we do research, understanding those disparate impacts and understanding treatment and care across our communities. So when we look broadly from the beginning, from the research we do, the types of treatments, therapeutics that we discover, understanding how they impact different communities and the best way to treat our diverse communities, and then having access to care. So if we have that knowledge and those tools, then people need to have access to them. And again, one big part, and obviously for mental health too, comes down to workforce. We need more healthcare professionals across the board in so many ways. We need more caregivers. These are, so we need to make sure we're investing in our workforce because that's also key to that access and meeting the needs of everyone in our communities in all parts of our country, in rural areas, in urban areas across the country, because we know we do not have equal access and availability to care in every zip code of our country. That's another area that we've got to continue to work to address. So lots of work to do there. I think we have made some steps forward with the investments we're making. But again, more that we need to do, and we continually need to look at what's working and what's not working, use that information so we are continually improving.
Thank you. And yes, thank you for mentioning, having diverse professionals, because I think it's very important that our communities are able to receive service from people that look like them, that understand their culture, their way of life, and can help to navigate our complex systems. And so thank you again for highlighting that as well. Earlier, you had mentioned supporting Medicare, strengthening Medicare. Can you share with us your thoughts about privatizing Medicare?
I strongly oppose efforts to reduce benefits or privatize Medicare. This is a conversation that's come up occasionally. Republicans attempted to reopen the Medicare prescription drug donut hole in 2013 and 2015. And those were both times when I very much stood strongly in opposition to that and fought to protect older Americans in Washington state who benefited from reforms that have reduced their out-of-pocket costs. And clearly we're moving forward now with the Inflation Reduction Act at doing even more to reduce those costs. So that's what we need to focus on. As I said, continuous improvement. We learn, continue to adapt to changes in terms of what we learn that provides better healthcare, but also to make sure that we have the accessibility and the availability of healthcare to everyone in our communities. That needs to be the focus, as opposed to saying that that we are going to replace Medicare, for example, with a voucher or some other process. The core issue of making sure we have great coverage for everyone should be our focus, and not leaving millions of seniors with higher costs without adequate healthcare coverage. So I definitely stand against privatization. I think that we have a program that has helped millions of Americans. There's more that we should do to continue to strengthen it. And we've talked about some of those already today. That needs to be our focus, strengthening it, making sure that we have support for the programs, and making sure that we continue to strive for better outcomes for older Americans across the country. And we move forward, and definitely the Inflation Reduction Act was another important step forward there. That's got to continually be our focus.
Yes, thank you. And I love the continuous improvement, right? And I think Kathy McCall from AARP is going to join us and provide the last question. Kathy, would you like to come on camera?
Thanks so much, Mary. And again, Congresswoman DelBene, thank you so much for your advocacy. The last question is an issue that's near and dear to my heart, which is around technology and social isolation. We saw during COVID the impact of social isolation, and we really tried to help, seniors and older adults use technology, because we know social isolation is like, I think there's an analogy of smoking 15 cigarettes a day in terms of your overall physical and mental health. But technology is still really inaccessible. I know there's a lot of work going on around rural broadband, and here in the state, they're looking at broadband and connectivity issues, but there's also a skills level, and having older adults more comfortable and able to use technology and affordable. And I know the ACP, formerly the EBB, made technology more available for lower income folks. But is there a commitment in Congress to continue to drive forward and address this digital divide? Because it also impacts communities of color and lower income seniors and seniors of color in our minority communities and rural communities. And for telehealth really to work, it's got to be affordable, accessible, and people have got to be comfortable with using technology. Thank you. And again, thank you for all your work.
Absolutely. Thanks, Kathy. Well, I am very passionate, about technology, and technology doesn't help anyone if it's not usable or accessible. So this is important. I represent a global technology hub. I'm one of in the King County part of my district, and you can drive an hour from this area of my district and go into rural areas towards the mountains where folks don't have broadband or even good cell service. So it's happening right here in our communities. The infrastructure law that we passed definitely will help in terms of the broadband side and access. We have $65 billion to ensure that all Americans can access affordable, reliable, and high-speed internet. That's continuing to be rolled out, and so also take some time to get to everyone in our communities. And the pandemic has definitely showed us that access to the internet is a basic necessity for everyday life, communications, and staying connected with people, definitely, and also healthcare. You talked about the ACP, the Affordable Connectivity Program, that provides $30 per month for qualifying households to purchase internet access. So we've got availability, one issue, affordability is another issue. It's $30 per month, $75 per month on tribal lands. The Biden administration has also engaged service providers to offer reliable service for $30 per month or less. So qualifying households in certain regions can get reliable internet access for free in many places. So there are programs to help there. So now we talk about basic broadband and getting that available to all communities. Then it's can you afford it? So work that we're doing there, and the Affordable Connectivity Program is one issue in terms of addressing affordability. But you pointed out another, which is usability. One, making sure people have access to devices, the things they need to connect, something that they feel comfortable using and know how to use. And this is another place where I think resources in our communities can be really helpful. Having our senior centers, other areas where people gather, incredible places where people can get more education and help. There are folks who have volunteered to go directly to give people, help people set things up and provide access. This is a place where a volunteer community can be incredibly helpful to help people understand that, because There are a lot of things that technology can do. Sometimes it's very difficult to understand how it does it or how to use it. And so we can continue to make sure that as a community, we're providing those resources to everyone in our communities to help them out. So usability, affordability, availability, those are key areas. And we're helping provide resources there because this has to be a priority for everyone to access these services.
Thank you. And with our last few minutes, Congresswoman, I'd like to turn it over to you. And is there anything that you would like to leave us with?
Well, first, Mary, thank you for bringing us together and for being such a great host. We've had some great, we've done some great work recently. I'll always say that we always have more to do because we always do. Things change, we learn. You said it, continuous improvement. And so I think many of you have asked what you can do to be helpful. Continue to share your stories, address concerns, highlight what's working and what's not working. That helps provide information to elected officials like myself for us to put together solutions that can be helpful. And we want things that actually work, so we need to know the things that help make it work. To Kathy's point on not just having broadband, but making it usable, all of these things are important so that we have things that actually solve the problem on the ground. So I appreciate the engagement in such an important area, but that it's not just engagement today, ongoing engagement. So please continue to reach out, share your voices and concerns and ideas. All those things not only help me to do a better job, but make sure that all of us are engaged in the community and helping make things better. So thank you so much for inviting me to join you today. And I hope everyone has a great day.
Thank you so much. And I appreciate this lively discussion today. We are out of time, but a huge thank you to you, Congresswoman DelBene, and for being here today and taking time to listen to the experience of older folks in our area. We are grateful for your advocacy work in DC, particularly around healthcare for older adults. This work is so critical, and you are a true champion of the people. Another big thank you to all of the partners that put this event together, including AARP, the Washington Association of Area Agencies on Aging, and the City of Seattle's Human Services Department. And with that, I'm going to close our program today. Thank you to everyone for being here and showing up for yourself and your community. We look forward to seeing you together in 2 weeks when we have another discussion with Congress members Adam Smith and Pramila Jayapal. Thank you, and we are truly stronger together, and have a great day.